Hi everyone. In this video, we will be discussing about the carotid artery and the branches of both the external carotid as well as the internal carotid. So first of all, carotid artery. The common carotid artery arises on the left side from the arch of aorta, and from the right side it arises from the brachiocephalic trunk. Similar to that as we seen in the subclavian artery. Then bifurcation of the common carotid occurs at the level of upper border of the lamina of thyroid cartilage, that is at the upper border of the C4 vertebra. Okay, at the upper border of C4 vertebra it is bifurcating. Then the carotid pulse can be felt at the interior margin of the sternocleidomastoid, and the common carotid artery can be compressed against anterior tubercle of transverse process of C6 vertebra as the carotid tubercle at cricoid cartilage level. So at C6 it can be pressed against the interior tubercle. So now we come to the branches of the external carotid artery. In the external carotid artery, we have anterior branches, posterior branches, medial branches, and terminal branches. In the anterior branches, we have superior thyroid artery, then lingual artery, and facial artery. You don't need to remember this mnemonic. Just remember what are the anterior branches: posterior, medial, and terminal. Anteriorly, we will have thyroid gland, so superior thyroid. Inferior thyroid was from subclavian artery. Okay, so superior thyroid, then lingual for the tongue, and facial. These are anterior. Then posteriorly, we have occipital and posterior auricular. And medially, we have ascending pharyngeal, and terminal branches are maxillary and superficial temporal. Superior thyroid, lingual, facial, ascending pharyngeal towards the medial side, then superficial temporal and maxillary, and lesser and occipital and posterior auricular towards the posterior side. Then we have branches of the internal carotid artery. It is divided into four parts: cervical part, petrous part, cavernous part, and cerebral part. Cervical part has no branches. Petrous part, it has carotid-tympanic branches and pterygoid branch. Carotid-tympanic along the carotid, and tympanic branches and pterygoid branches. Then in the cavernous part, it has branches for cavernous sinus, cavernous branch, and hypophyseal branch, and along with it it has meningeal branch. So for the sinus, for the meninges, and for the hypophysis. Then in the cerebral part, for the eye, ophthalmic branch, and anterior choroidal branch, and then anterior cerebral, middle cerebral, and posterior communicating branch. These are in the region of circle of Willis. So that are branches of internal carotid: caroticotympanic, pterygoid, cavernous, hypophyseal, and meningeal, ophthalmic, anterior choroidal, anterior cerebral, middle cerebral, and posterior communicating.